This episode of the Moms Network is brought to you in part by DuPage Medical Group. We care for you.
Welcome to the Moms Network, a talk show all about moms and family. Today, Grace, Lindsay, and I are joined by Dr. Danielle Cooling from DuPage Medical Group to discuss allergies and how to best manage them. Dr. Cooling, can you share a little bit about your background and why you became a pediatrician?
Love to. Well, to start off with, I always knew I was going to work with kids. I just love working with kids. I think it's a fun age to work with. And I love the idea when I was considering medicine of more preventative care than actually treating or diagnosing things. And in kids, a lot of it's preventative. A lot of it's working through and keeping them healthy and keeping them developing and keeping them moving forward rather than having to worry about a lot of and trying to avoid the complicated things as they get older. I love working with the parents as well, though, as a collaborative effort, because of course it's a team effort to keeping the kids healthy with the parents too. So I love that about my job.
That's awesome. Mm-hmm. And you have children yourself?
I do. I have a just turned 5-year-old boy named Luke and a now 7-month-old named Jacob. So
that's awesome.
A big gap, but
it's not that big. We have a seasoned moms group on the branch,
mm-hmm.
and we're having a social, and they're moms that are 50 and have an 18-year-old and a 3-year-old. So that's a super big gap.
Yeah.
So
that's true. That's a much bigger of a gap. And it's what worked out for our family, so it's working out beautifully. So yeah.
Mm-hmm. Now, do your kids struggle with any type of allergies or anything?
So I struggle with a lot of seasonal allergies. I feel like I'm sniffly and hot water eyes right now. So my son. Not diagnosed, it's more clinical diagnosis that we've had for him based off of my history, has seasonal allergies, and he does respond well to the long-acting antihistamines when he's struggling with his symptoms. He also, as a baby, had a milk protein allergy, which is a little bit different kind of an allergy compared to a food allergy as you get older. You can outgrow a milk protein allergy in babies, which is wonderful because he now drinks dairy or does dairy and milk products without a problem. So he struggled with a little bit of food in the beginning, no food now, more seasonal now. So far, the baby is doing well, so nothing right now. So,
it seems kind of like a crapshoot these days. I don't remember all of these allergies being around. Do you?
I definitely feel like it's more prevalent for sure now. I have a lot of friends that have kids with very severe allergies. You get into the peanut allergies more, anaphylactic reactions, that sort of thing. I have a friend who, the first time she gave her kids peanut butter, she did it in the ER parking lot.
Did she really?
She was so afraid to do it. She said, I'm going to drive to the hospital. So she put the kids in the car. She drove to the hospital, and she sat in the car in the parking lot at the ER and gave her kids peanut butter for the first time because she was just so paranoid, because you read these really terrifying things about some of these reactions, and typically, and I'm sure you can attest to this, Dr. Cooling, but the more reactions you have, the worse they get each time, and that sort of thing.
Progresses.
They progress, yeah. Our daughter had a milk protein allergy as well, and our pediatrician, thankfully, her sister is an allergist, and she was able to diagnose an FPIES, like a food protein-induced. I don't remember what the exact acronym stands for.
Food-induced enterocolitis.
Yes, yeah. So it was.
Say right now. But it's affecting your GI tract, unfortunately.
Yes. So for us, we figured it out. I was nursing for the first 6 months completely, and thankfully, she didn't react through my milk at all. So I didn't have to change my diet. I know some people do have to change their diet for these sorts of things, and their kids have maybe 2 or 3 foods they eat, period, and it's really, really detrimental to their everyday life. Thankfully, we didn't experience that, but we tried yogurt at 6 months. When she was 6 months old, we tried yogurt, and she threw up everywhere. It was a reaction unlike anything I had seen before, and it was terrifying. We called the pediatrician. She said, watch for dehydration, all of these things. And then I was unable to pump enough at one point when I was going to be away from her, so we tried some formula. She had the same reaction. That's when we pieced it together with our pediatrician that it was that kind of reaction. Avoided all dairy until she was 1. She outgrew it, just like Dr. Cooling mentioned. So thankfully, we're fine now that she's almost 5. She has no real reactions anymore.
Yeah, good. How about you, Grace? How about your kids?
I went through a similar situation actually while I was nursing both my boys. Any type of reaction they would have, whether it was they were having reflux or throwing up or just they weren't sleeping well or they were in discomfort, I assumed it was something that I ate and then passed on to my children during nursing. So I was so anxious, especially with my first, because it was all very new. So I tried the elimination diet, and that was really hard.
So hard.
I did it for one day and I gave up. I said, I can't do this. I'd rather not nurse.
So hard.
I mean, it's like my they were so sweet. Pediatrician gave me the whole map of like how to do it and what to remove and for how long, and I'm looking at it. I'm like, this is great. My kid's gonna get the best milk ever. I'm gonna be miserable.
Right? Like, where do I put
Or
my
you're gonna
cheese?
lose a lot of weight.
Where's my cheese in here?
I was like, I don't know if I could do this, and I did start, but it was one of those things too where she didn't put a lot of pressure on me, and she said, listen, by the time we actually figure out what it is, this could be weeks down the road, or they could outgrow it. Like, let's just keep trying and see. And if it's not a very strong reaction where, they're super sick, if you feel like there's a little discomfort, maybe there's something, but if it's nothing extreme, like, go easy on yourself and let's just take time and see what this is. So, and that's what we did. And luckily, he just has reflux, and a little over-the-counter something.
I am curious, Dr. Cooling, do you feel like the norm is people say, to avoid getting allergies or creating them, that you should be trying things or giving your kids things?
So they've kind of gone back and forth on that a lot. Definitely in the beginning of my training, it was more like introduce foods later and to try to avoid creating allergies in kids, particularly food allergies. And then now it's more introducing foods at a younger and younger age. So now we're encouraging as young as 4 months, 6 months old, in exposing them to your solid foods, and including even things like peanut butter, and there's now snacks and things like that you can do to like baby snacks now that have like the peanut butter powder on them or nut powder on them to get them exposed at a younger age. So the thought is now if you expose them younger, there's less of a risk. Although we still kind of tread lightly when there's a lot of allergies in the family of how young we want them to start because of the potential for reaction. Although it isn't necessarily a genetic thing, we do see trends in families. So it's a little bit of a what you're supposed to do textbook clinically wise, and then what we as practicing wise with our families and making sure they're comfortable exposing their kids to those allergens and knowing what their other kids might have gone through. So
I have a friend whose son has a lot of severe allergies, and originally their pediatrician recommended trying to keep their other kids, their middle son specifically, exposed to those things so he didn't develop anything, but it was so risky for their older son that they had to just completely make their entire home dairy free because they were trying to keep his bottles upstairs in his room, but then he had contact issues where then he was breaking out and every reaction was worse and worse and worse, and EpiPens and ER visits and all of these things that were really terrifying that they said, unfortunately, our house is just going to have to be completely free of these allergens at the risk of their other kids just because they
Which has to be
had to
so
keep their older
scary.
son safe.
Yeah, how did they go to school? I mean, knowing
Their
that-
preschool is very, very good about their allergies. And I know, and actually our daughter goes to the same preschool that their son started at, and they have a lot of guidelines and rules about, even for our daughter's birthday, what I could bring in and that sort of thing. But then now he's at Ann Reed in District 203, and they have a lot of kids there.
You hear some moms online that are like, oh gosh, why can't we bring this in? Like, if you don't have a child that struggles with it, my kids don't. They've had little seasonal allergies. My son Christopher, if he picks up Ruby, and he then ever gets it in his eyes, he definitely gets it. And I was laying on the couch the other night, and I looked at Jason, and I was like, I feel like I just cut onions. Like my eyes started watering, and I don't have allergies to the cat, and I don't have allergies at all. But he's like, I bet you got a ruby hair like in your eye, or you really specifically got that dander. And I was like, this is terrible.
I know.
I had a friend of mine who said that his son had severe peanut allergy, and he went through some sort of process later in life, like at 17 or 18, where they do this very slow weaning in of eating peanuts, and at some point that you eat one peanut a day. And he was actually able to kick the peanut allergy, which was amazing. But he said that his son had a reaction, a really bad reaction, and they were in downtown Chicago and had to go to the hospital there. And the hospital in Chicago said that they really don't have a lot of reactions down there compared to the suburbs. And one of the things that they mentioned was how we keep everything so uber clean, that we're Cloroxing everything, and that we're not letting our kids get dirty enough almost.
Sure.
Is that, have you heard anything about that?
It would make a lot of sense because, of course, a lot of our allergies are what we'd consider like IgE mediated, which means our IgEs are antibodies that recreate against the allergen. As your body is kind of trying to fight it off. And so the more you're exposed to that allergen, you're going to hopefully protect your body about creating the bad antibodies or the bad reactions, I should say, to those allergens. So it makes sense if you're exposed to it more that way. And we definitely have seen that trend of that when I've worked more inner city to suburbs, you definitely see more allergies in the suburbs than you do in the inner city.
So interesting, you know?
Could I ask, why is it that some things we're exposed to as a child, no issue whatsoever, and then as an adult, we are totally like just sick as can be?
Similar thing. Like, unfortunately, our body can create those antibodies anytime throughout your life and can create that. So the more sometimes at one point your body just decides, oh, I'm not going to tolerate that allergen anymore, and creates that reaction. So unfortunately it can be anytime throughout life. Usually it's more seasonal allergies that we see that development, or like environmental, I'll say, so whether it's to a pet or to dust or something outside. But food allergies less so, but unfortunately you can, or even antibiotic allergies, unfortunately, that can develop. They can really develop at any time. Of course, we see that food and antibiotics more in kids, but we can see it as people get older. And once again, it's a similar notion of the more you're exposed to that allergen, the worse the reaction is. You were kind of saying, where you're going towards the EpiPen route. Same thing. The more you're exposed to an antibiotic, for example, or that food, sometimes your body just eventually has a bigger reaction, and you may have tolerated it before, but now you're not going to. But it's frustrating.
I had penicillin as a child, who knows how many times, right? I had mono in college, and I was given penicillin, and I rashed out from head to toe. Like, I got kicked out of my dorm.
Oh, really? They're like, we don't know what's going on.
You gotta go home.
But you need to go home.
I had to go home from school for like 2 weeks until that cleared up, because I was the girl in the hood, like just like
it's an awful rash. It's an awful rash. So mono actually creates a drug reaction to penicillin. So it's not actually an allergic reaction. It's actually just you don't give penicillins to kids that might have mono. So you probably have an allergy.
I'm about to call up
right. Like, hey, remember me from all those years ago?
Are you kidding?
No. What? So you're not allergic to penicillin, probably, which is exciting.
This is the best episode we've ever had. You're kidding me?
Let's talk offline.
Every time we get penicillin in the house, my kids have it for something. Like, okay, I can't touch it. I can't touch it.
Oh,
as long as you don't have mono, you're good to go. Which you shouldn't. You shouldn't.
So we have time for one more question.
Okay. Yeah.
As a pediatrician, when do you have enough concern over symptoms a child's having other than the sniffles or something like that to actually refer them to an allergist?
That's a great question. Difficult to manage symptoms, and because that's also the debate of like, do you test or do you not test? And so by putting the two options for testing is either doing a blood test or doing the skin testing. And for kids, either is not a fun option. Like both are uncomfortable for kids.
Sure.
So if they just have more mild symptoms in terms of sniffles and congestion, runny nose, a little cough, and it definitely seems to be trending spring or fall, or it's always in the winter with dust concerns, we just try clinically managing it. So we put them on Claritin or Zyrtec and seeing how the symptoms do. If we're not managing those symptoms well with the over-the-counter medicines, whether they need eye drops or the nose sprays or the oral medicines, then we have the discussion of, is it important, do we want to talk about testing to see what it is that you're reacting to that we're not controlling well, and whether that's with a blood test or sending you to the allergist for that. Also, if you have recurrent infections, particularly like sinus type symptoms that where you keep having a hard, you're on antibiotic left and right for recurrent sinus infections, we'll get allergists involved to better understand of how we avoid that antibiotic usage and avoid that resistance to too many antibiotics that way. So a lot of times, and some parents want to know right away, so which is an option, but most parents try to do clinically treatment and managing over-the-counter medicines, and if we're having a hard time managing, sending to the allergist, or if we're having too many infections, sending to the allergist.
Okay. All right. Well, great. Thank you so much.
You're welcome.
Managing your child's health care can be challenging sometimes. Dr. Cooling, we appreciate your information and your advice.
You're welcome.
We'll be right back with more from the Moms Network. Stay tuned.
This episode of the Moms Network is brought to you in part by DuPage Medical Group. We care for you.
Of course, only real men finish The Rustler.
And breathe. I thought you said this was an intro class.
Some situations in life call for a little sage advice, which is why we're physician-owned and led. DuPage Medical Group. We care for you.
We're proud to call Naperville our hometown, where you can enjoy simple pleasures, such as a stroll along the Riverwalk or the excitement of a Friday night football game. It's where families can raise their children and plant their roots for generations to come. And so we're proud to be the city's nonprofit television station, keeping residents connected and informed through video storytelling on air and online. We ask that you continue to watch and share the stories about this wonderful town we call home.
This episode of the Moms Network is brought to you in part by DuPage Medical Group. We care for you.
Welcome back to the Moms Network. For our next segment, Erica, Lindsay, and I welcome back Dr. Danielle Cooling from DuPage Medical Group to discuss picky eaters. As a mom that had a child that didn't eat till he was 4.5 and a doctor that specializes in nursing and feeding issues, this topic is near and dear to my heart. Dr. Cooling, have you seen a rise in kids that are struggling with feeding issues?
I think it depends what we're talking about with feeding issues, of course. Like there are traditional picky eaters where it's more on the behavioral side of they just don't want to eat those foods, and you have to work with kids on that, versus kids that generally struggle, whether it's a sensory thing, a texture thing, or an actual anatomy, how they swallow function thing.
Sure.
So there's a lot of range when you're talking about picky eater where you're actually, are they really a picky eater, or is it actually just a problem that they're
a feeding disorder?
Correct,
Yeah.
correct.
Okay.
So it depends on the range. I feel like we are a little bit more lax sometimes as in the community in terms of letting our kids get away with sometimes picky eating. But I also realize as a mom that it's also, you do what you need to do to survive also too.
Some days you have to get out the door and get something in their mouth, right?
And sometimes, once again, it's not no matter what you do, you just need to know that your kid's getting fed and growing and getting the nutrition they need, and whether it's not like everyone else's breakfast or everyone else's lunch, like it's okay.
Yeah.
So it's okay to feed your daughter hot dogs in the car.
It's protein. It's protein. It is. It is
Did you say they're turkey dogs?
They're turkey dogs. Yeah. It happens. I pick my battles in the morning sometimes.
You have to.
Our daughter is very picky.
Yeah.
We went to her 3-year well visit with her pediatrician, and I looked at her pediatrician and I said, how do you know the difference between a toddler being a toddler and just being picky and then an actual issue? And she said, really, if it's just detrimental to everyday life. And we started talking through things. She referred us to a speech and language pathologist to check the function, like you mentioned. And actually, our daughter saw Dr. Kathy when she was a baby. That's how Kathy and I met. She was about 9 months old, and she did do some adjustments because she had some issues with nursing and that sort of thing. So we kind of started to see this trend of sensory issues with her and other things. Bath time. I learned that tipping your head back during bath to wash her hair was like the most vestibular input we could give her. So she was having some issues then. So then we were kind of piecing things together. Okay, let's go for occupational therapy for sensory issues in general, and then some feeding therapy with an SLP. And we did that and saw a huge difference in some things that she was then starting to try. Cucumbers, carrots, all these different tactics they did in feeding therapy that was remarkable to get her just to try them and get past something that isn't just behavioral, that was textural for her. And she still is a picky eater. She's still, she's still eating hot dogs, turkey dogs for breakfast sometimes. But we are able to kind of get her to try new things. She came home from school earlier this week, and she said on Monday, she said, "Mom, I ate carrots at snack time." And we get a big high five and a hug, and we're so excited that she was trying it. So yes, I think that for us, we looked at the number of foods. If it wasn't, I think our pediatrician said, and the SLP said, if it wasn't for the number of fruits that she was eating, so you count apples, blueberries, watermelon, peaches, that she would be categorized as a problem eater, because really the number of foods that she was eating other than counting fruits individually was so small. So then the feeding therapy kind of helped to try to expand that, and Dr. Kathy was able to help when she was a baby, when she was nursing.
Good.
I know for when I was like a teenager, even probably up to 16, 17, I would eat salads of like iceberg lettuce, carrots, and cucumbers, and that was it. And now I'm the salad queen. So I think there is some differentiation between, I'm really just a picky eater, right? For my son, feeding therapy wasn't the solution for him. I know you said your daughter thrived in it. And so he was born, make a super long story short, but he was born, nurse no problem, but then wouldn't accept any food. And at 1, we went to the pediatrician. They said not to worry about it. At 2, he was still drinking only formula out of a bottle. We did feeding therapy for 2.5 years. It just didn't help him. He could lick a lollipop. And then we found a doctor who is a chiropractor that specializes in sensory disorders that came to the office to see him, literally put a glove on, put his finger in his mouth for 10 seconds, and then said, okay, he should unravel in about a month. And we kind of laughed when he left because it seemed like nothing. Next day I dropped him off at feeding therapy, and he started eating everything on the table. Like the therapist called me crying, going, "What did you do to your son?" And I'm like, "Why are you crying?" And so as a chiropractor, and I see kids all the time, I trained with him over the years, and so I specialize in nursing and feeding disorders. It certainly doesn't help every child, but especially for that swallowing part, for Nick, the nerves that control the strength of the swallowing muscle was not as strong. And so for him, he knew at 6 months old, if I put food in my mouth, it's not going to be safe. And so the cranial adjustment just balances out part of the cranial area to allow the cranial nerves to function properly. So it's a very easy solution if that's the problem. Right. But when do you see parents coming in with concerns? Where does it start? Nursing? Does it start?
Oh, I mean, it can definitely, for every kid it's different. It definitely can start as young as nursing. Of course, you worry about things like an upper lip tie, a tongue tie, things like that with nursing, contributing to feeding problems at that point. If they already have a swallowing issue, you'll see that as early as obviously with the bottles and nursing. We do see some kids at 6 months that just refuse the puree, and some of those kids are just like, I don't like that texture.
Right.
And then you start, if you wait a little while till they can actually handle finger foods, they actually do take that really well. And it's truly just the texture of purees. They're like, I don't want that, but I'm ready for the big people food, and chewing, it wasn't a problem. So some kids, it's a very temporary thing. Some kids, that texture, trouble with the texture lasts longer than that. So every kid's a little different. I always say that for 1-year-olds, most 1-year-olds have fluctuating appetites, they have fluctuating taste buds. They are naturally going to be picky eaters because their taste buds are happening so often, so it's hard to feed a 1-year-old. So that age is really hard just to know, like, are you being a 1-year-old? Or I say 1 and 2-year-olds, so even like the toddler age in general is that way. So it's very hard to know when to get your child help in that respect. And even on my end of like, how much do I need to worry about this and how much do I not need to worry about it? How patient we should be with the kid's body versus pushing or investigating more into swallowing dysfunctions or texture, sensory processing problems and things like that. So sometimes, frustratingly, on the parent's end and on my end, is getting when to get that diagnosis. And then definitely, of course, if you see trouble with growing and developing, that's affecting it. Of course, you're going to do it sooner if they're growing and gaining weight well, and it's not affecting their day-to-day too much. You might be dragging your feet a little bit more just to see if on their own they get there. So it's a frustrating process in terms of feeding. It is. It is. I'm definitely on the parents' end. It would be too. But.
I feel like it's a bit of a tunnel. I say, like, I have a daughter who's 8 and a son who's 5, and she was picky as well. And we don't have any sensory or texture, any of those physiological issues to my knowledge. But she, ate everything Then they realize this cookie tastes better than steamed broccoli, and they go into a tunnel of no.
Right.
And around 6, I would say, she got out of the tunnel, and she will. Does she eat everything? No, because she's only 8.
Right.
But is she trying more things now? Yes, and that's sort of my light at the end of the tunnel, because I have that experience is with my son. You know, I think he will get there. He will get there. And the other, struggle is, you say, well, okay, every night we're going to eat dinner as a family. Well, that doesn't happen. One's out of town and there's activities. So it's not like, well, I made this meatloaf and veggies, everyone's eating it. It's, I'm making myself a quick bowl of soup or salad, so I'm just going to give the kids something they like. So there's not enough practice in the discipline of you're eating what's on the table.
Right.
And that's a personal problem. That's within our family
I
structure.
think that's in a busy family problem, I guess.
Right.
And as your kids are involved in more and more and with work and things like that, I think it's just hard to sit down as a family. And it's nice to do, and hopefully there are some nights you can't or able to do it, but definitely when you're not making the same thing for everybody, it's hard to make the rule of like, well, this is what I made. Like,
It's hard to balance, because I remember sitting at the table for like 2 hours being told I had to finish my green beans, and I hated them. And I ate some vegetables. I wasn't that picky of an eater as far as I would try things and stuff, but there was this mound of green beans. So it's hard to know, okay, should I force my child to eat this? For my son, if I tried to force him to eat stuff, it would have been dangerous. People told me, just force him to eat. I'm like, I don't think you understand. So again, there's that balancing act of, am I doing the right parenting move to, you can encourage, but forcing in some ways is beyond where the child needs to be based off of what the problem is.
I get very frustrated when I see that, because you have a 5-year-old crying, screaming, and you're literally trying to shove food. And I just think this is setting up a lifetime of a relationship with food that is not enjoyable, stress-free.
Yeah, I don't like shoving food in kids' mouths. No, I agree with that. I think that rewarding behavior and rewarding trying is a good thing. If there's a treat after a meal or like a dessert after a meal, they should that rewarded by getting that, versus if they're not going to even to give you one bite, you should be careful of how you're rewarding them at a young age for that. But I like at the younger ages their age bite rule. So for a 3-year-old, give me 3 bites. You're 3, give me 3 bites. If you're 4, give me 4 bites. As they get older, it's harder to get more.
That's why I'm overweight,
give me 40 bites.
Let me have 46 bites of that ice cream.
Well, the little kids, you can kind of work through that a little bit, but I don't like in the little kids. I don't encourage shoving the food in their mouth. Usually it's you want to encourage, you try a different variety. Obviously they shouldn't get everything they want, but you try a different variety, try to get a couple bites in, reward the behavior when they do it, and then you try again the next day. And you try again the next day.
Yep. It's just kind of a never-ending journey of trying to figure it out. And also at the end of the day, are you healthy? Are you growing? Are you strong? Are you sick all the time? Right? And so at the end of the day, if they're eating a number of foods and they're getting at least some variety, usually it seems as if as they grow into adults like myself, I want to eat all the salads. So,
I always think it's definitely better than what I was eating in the 80s. My kids literally don't know what a Pop-Tart is. They don't know what, it's got to be better.
As long as you're looking for, in general, well-balanced things. Did they get some protein today? Did they get any fruit or vegetables? Are they on a multivitamin? Right. Is it all carbs?
Did they get enough calories?
Right.
Okay.
Yeah.
There are so many reasons kids have feeding difficulties, and we are thankful that there are a number of types of doctors and therapists that are able to be part of the solution. Thank you to Dr. Cooling for joining us, and to you for tuning in to the Moms Network. Remember, you are always invited. Thank you.
This episode of the Moms Network is brought to you in part by DuPage Medical Group. We care for you.